Welcome to DocVak. Today on World Asthma Day, I wanted to start a new series that covers asthma in depth. Asthma to me is one of the most misunderstood, misdiagnosed, and underdiagnosed conditions that is out there. There's a lot of prevalent myths about asthma, a lot of misconceptions about asthma. Often people feel asthma means somebody who is perennially wheezy and short of breath and puffing on inhalers. And the truth of the matter is, many patients with asthma are not like that at all. And a large number of people who have asthma don't even have a clue that they have it. So, in this series, we'll try to distill it down to the basics, really get a very grounded understanding of what exactly are we talking about. So, let's start there. What is asthma? So, asthma is a disease of inflammation, and it's inflammation not of the but of the airways. The airways are the passageways, the tubes that take the air or conduct the air and get it into the lungs. And the problem in asthma, it is in these air passageways and specifically in the inside lining of these air passageways where that inflammation is. And when I say inflammation, what do I mean by that? You probably have seen eczema or a skin rash. You know how the skin gets. It gets very itchy, irritable. It may appear red. Maybe there is some swelling on the skin. And that really is inflammation. Except when you have eczema, it's on the outside skin. Now imagine if the inside thin lining of the air passageways inside in your lungs starts to get that way. That is really what asthma is. Now, in the outside skin, what you get when you get a rash like that is it usually becomes intensely itchy and it is irritable. Well, on the inside skin, obviously itchiness won't be a symptom, but what it manifests as is coughing. These patients typically will cough a lot because their inside skin is getting very, very itchy. Now, in addition to that, because of that lining becoming itchy, those air passageways tend to also become very twitchy. So they tend to constrict, particularly when the air that you're breathing is polluted, has a lot of smoke or smog or dust or maybe other kinds of allergens. And whenever that kind of an air is breathed in, that inside skin gets really irritable, gets hyper itchy, and those air passageways then try to start squeezing. They don't want that bad air coming in, but that is the only air that is. And so for the person who experiences it, he experiences it as I can't breathe because my air passageways have all suddenly decided they don't want to breathe this air. So, in a sense, that is where the shortness of breath comes in, where the person says, I'm having a hard time breathing. And that is when they reach for that inhaler to open up that twitchy air passageways that are constricting. And in severe cases, this is when that wheezing may come in, where you hear that little whistle that is coming out from the lungs, like that kind of a sound is produced when those air passageways have really started to shut down. And that happens mostly in the severe cases. So just because you don't hear that sound or you don't have that symptom doesn't necessarily mean you don't have asthma. And finally, if the twitchiness and the spasm of those air passageways tends to be severe, that spasm can cause a sense of pain. And that can be felt as a heaviness on the chest, or that can be felt as a squeezing pressure. Some people may even mistake it for, am I having a heart attack, because it's at the same time they're not able to breathe. So those are sort of the symptoms to watch out for. And finally, something that is, I feel, poorly understood, which is in a very small percentage of patients, that itchiness in the skin, that rash or inflammation in the skin can also produce a little bit of weeping, a little bit of fluid building up, and that occasionally may cause mucus production. In some patients there is a lot of mucus, but in the majority there isn't. And the reason this is important to understand is a lot of patients have the feeling that they have mucus stuck in their lungs. They have a feeling like, if only I could just cough that mucus out, I would feel so much better. And they go around chasing for different therapies that allow them to clear their lungs of mucus. And that is a mistake, because oftentimes it is just the itchy, irritable skin that is giving them a sensation of there being mucus. And there isn't really that much of mucus. So that's important to understand. So there's a few things that are unique to asthma, and that is worth noting, because it can give you a clue as to recognizing asthma in yourself or in your family or friends. One of the things is the symptoms tend to be episodic in response to triggers. And triggers simply mean something, some activity, or something that induces symptoms in a susceptible asthmatic. The commonest trigger, of course, we already talked about, which is the air quality. So that can be smog in hyper polluted cities that we unfortunately are very familiar with, those of us living in urban areas. It could be cigarette smoke, or just smoke in the atmosphere from fires and natural disasters. It could be chemicals, depending on what kind of field of work we are in. If we are exposed to sprays and dust, or in agricultural occupations, for example. So those are all the typical airborne triggers. The second, and probably the most common one, is infections. So oftentimes people will get a viral infection, let's say 2 or 3 days of a flu, and then they get a runny nose or an upper respiratory infection, typical sore throat, scratchiness, blocked nose, nasal symptoms. Those go away within 2 or 3 days, but then after that they have a lingering cough that just doesn't go away. So it is there for days, sometimes weeks, or even months, and they just keep coughing and coughing, and they go through rounds of antibiotics and nothing seems to be helping. And that is a very classic symptom of asthma, and a classic trigger of asthma. And the third is, of course, allergens. Sometimes it's obvious, like you're allergic to cats or dogs, and if you're around them, then you immediately start to develop coughing or trouble breathing. But some of it could be very difficult to really pinpoint, because it may be something in the environment, and there's obviously a gazillion things out there, all kinds of trees and plants and pollen. So exactly pinpointing that could be difficult, but you may have some clues that if I'm outdoors or in certain conditions in the environment, some days are really bad days for me, that kind of a thing. So these triggers are an important thing that characterizes asthma. One trigger in particular, which is very significantly underdiagnosed or misdiagnosed, is exercise-induced asthma. This is where the only trigger for the patient is exercise. Whenever they do any activity, they run or do cardio in a gym, for example, they start to get short of breath. And this is a really important topic on which I'll make a separate video on. So make sure to subscribe and catch that particular episode, because I think it's really important to understand that. In addition to triggers, which we just looked at, the other thing that is unique to asthma is the fact that the symptoms will worsen at night. Asthmatics will have a much worsened night episodes of coughing and of trouble breathing, and the reason is nighttime is when our body's cortisol is our body's own natural anti-inflammatory. It keeps all the inflammation levels in the body down, and the nighttime is when those cortisol levels go down. And that is when, if during the day these air passageways were kind of kept under control in terms of that inflammation, in terms of that itchiness, once the cortisol levels are down, the inflammation starts to go up, and that is when the itchiness goes up. And so patients will often wake up in the middle of the night coughing and hacking, and sometimes with a squeezing sensation in their chest, or not being able to breathe, and really reaching out for these for their inhalers. So those were the two unique things for asthma, which is the triggers and the nighttime worsening. In subsequent episodes, we will talk a lot more about asthma, of course, in terms of how to get to a diagnosis, what kind of tests to expect, what kind of treatment options there are, particularly inhalers. There is obviously a gazillion inhalers that are out there, look all kinds of shapes and sizes. So we will figure out what is the best way to decide which one is the best for you. And finally, the most exciting development in asthma, which is the advent of these biologic injections, these magic injections that I like to think of them as, which are monoclonal antibodies, a wonder of modern science that has really allowed us to completely change the game in asthma and allow hundreds and hundreds of asthmatics who had severe asthma to a point where their asthma is completely in remission and they don't have any symptoms now at all, and not just temporarily, but for years and years. So, lots to cover, lots of exciting things to talk about. So, don't forget to subscribe and catch all these episodes. If you have asthma, you definitely don't want to miss it. And if you know of any friends or family who have it and for whom this content might be interesting, do share it with them and encourage them to catch these episodes. There is going to be a lot of information coming your way.